What's going on? Back with another video. I know it's been a long time, but I've kind of wanted time to pass before I dropped another update. I'm officially 4 weeks post-op from getting my subcutaneous ulnar transposition done on my right arm. Gonna drop kind of the ups and downs of things, let you guys know where I'm at. So yeah, first of all, I want to show you guys I can extend my arm out. I can bend it back. I can extend it. I can open up my hands. I do feel a bit of pain and tightness still, specifically around this elbow area, right on this bone right here. A little bit of tightness in the forearm when I have my arm straight and I extend my hand out. I feel pain radiating on this area of my arm at the moment. And also I have a bit of tricep pain back here. Talked to my surgeon on Friday and he told me that was all normal. So yeah, I hope that's normal. Also, I do have some pain here on this side. When I open up my hand, it's definitely all here. It's very painful. Yeah, but other than that, I believe everything's good. No more snapping, except when I do this and I lift my arm up right here in this area, I feel something's popping right here. I don't know what that is. I'm gonna actually tell my surgeon about that on the 24th when I go in to schedule my second surgery. Didn't want to tell him over the phone. Just wanted to tell him in person so I could actually show him what I'm talking about. It doesn't happen when I do this, but when I'm laying on my back and when my arm is overhead like this, basically when my elbow is sitting like in this position right here and I extend, I have a bit of popping right there. Don't know what it is. I think it's the nerve. I think that he didn't exactly grab it from all the way right here, or it could possibly be my tricep. But I'm gonna let my surgeon know on the 24th, and try to get to the bottom of that while we schedule surgery for this arm. But everything's good. Don't have any numbness. I do have, I don't know if you can tell here, I still got some of that claw finger going on. It's still a little bit tucked in. Slow progression, waiting for that to go away. But I don't have any numbness. I don't have any tingling. For the most part, only way that I do feel shocks is if I ice my elbow in this area specifically, and then specifically right here after icing. Super duper sensitive to touch. Definitely get the shock sent down, and then if I use my heating pad for a while, my arm gets a little, my hand, these fingers get a little tingly, but the nerve's still healing. I was dealing with my problem for a long time before I got surgery, so it's only natural that things hurt after surgery and things are a bit uncomfortable. I hope in the next coming months things feel a lot better, but I can only see with time, really. One problem that I think I have is that I have carpal tunnel that was overlooked because my cubital tunnel was so bad, but I still have thumb numbness. It rides out into my index finger and even a little bit my middle finger, and I have a really sore thenar area. It's really sore right here. It's the same, it's been that way since the same time I've been having cubital tunnel issues, but with the absence of these issues have begun to stand out. And so I think I have carpal tunnel as well. I let my surgeon know on Friday. And yeah, I'm gonna get a EMG test the day after I see him in office. So I see my surgeon on the 24th, and I'm gonna get an EMG test on the 25th. I asked my primary doctor who's put my order in for the EMG if he only put it in for the right ulnar nerve. I asked him if he can also add an order for my left side as well as my median nerve on both wrists, so that we can test for carpal tunnel. But I think it's a strong likelihood that I do have carpal tunnel, given that I have the numbness, the pain. My primary also agrees. I told my surgeon of the possibility. Well, I told him that I'm convinced that I have carpal tunnel. He said, let's focus on one thing at a time, but I'm gonna try and stress to him next time I see him, like, I think this is a serious issue. So, yeah. But, yeah, that's what's been going on pretty much. On shake one more time, I can't extend my arm, can't get both out there. And you see the finger, you see the differences in the two pinkies. If you can tell, they're both relaxed right now. One's curling in a whole lot more. And if you can tell, this hand's kind of tense in this area right here. I'm very tense, I can't let it go. I try to relax and then I gotta tense it back up because I get those shocks and stuff, that numbness going around. Another thing that I do have is that since I've been using this hand so much throughout the time that I've been having problems with this one and getting surgery, I've actually got de Quervain's tenosynovitis, I believe what it's called. I self-diagnosed myself, and I went to go see my primary doctor, and he was like, yeah, that's de Quervain's, and I'm like, yeah, cool. So I actually got some speaker braces. They're called speakers, so actually it's not the right one. Got one for both hands. I've been wearing them just in case. I actually think this has been helping with the carpal tunnel symptoms I've been feeling, which is terrible that I'm feeling those symptoms, but it is what it is. But this is pretty much just a thumb brace and a wrist brace as well, but keep your thumb immobilized. I've been sleeping with this for the last few days. Make my thumbs feeling a little bit better. Gonna sleep with them again tonight. And yeah, still doing PT. Actually got some new PT gear. I got some Theraputty. This is the medium one. This is the soft one. Using these are actually, I thought all the stuff that I had before was good, but this stuff is a real workout, yo. It's great. So I do hope that this helps me with my hand and everything that I'm feeling. I don't know if you guys can see, but you see the loose skin on my hand. It's definitely some muscle lacking in those areas. I'm trying to get those back. I feel pain every time I open up my hand too. It's normal though, it's part of healing, but yeah, still, I've been off pain meds for a long time at this point now, 2 or 3 weeks, and I'm mostly using the heat pack. I'm not even really icing too much anymore. I don't know if I'm really swollen, probably still am, but ice doesn't get blood rushing, and blood rushing means healing, and heat brings blood rushing to wherever the heated area is. So I've been kind of abusing my heat pack, trying to heal as fast as I can, been staying hydrated, drinking as much protein as possible, staying hydrated, eating as much protein as possible, and veggies, trying to keep a very balanced diet still as I heal. I think that's kind of the biggest thing that I'm in right now in regards to my ulnar nerve and cubital tunnel. I really think I have carpal tunnel, which is a whole nother beast, less ferocious than cubital tunnel, but still it is a whole nother problem. I'm trying to convince my doctor to take me serious, my surgeon to take me serious, and I want to, best case scenario for me is if I can get a carpal tunnel release with my ulnar transposition surgery, my next one. I think I'll be golden. So yeah, that's what we're dealing with here today. Just trying to explain to y'all what's been going on, why I've been gone. I've only been gone because I wanted time to pass. I feel like I can make an update every day or every couple of days, but I really got to take this kind of like week to week to see how I'm feeling. I feel like it just takes time to really see a difference in things. And yesterday I actually felt I felt like there was a significant change in the just my arm, the way that my arm was feeling. And today I felt like it was even more of a change. I feel like my tricep pain is kind of dying down a little bit. Still got some elbow pain, really. but my tricep pain's going down. It's still there, a little tender right here. I feel like this pain, it feels good for a couple of days, and it feels like the pain comes back full force. Then it feels good again, and then the pain comes back. I've been still using every single day mustard oil to massage. Throw some of that on my finger and just kind of go ham on the nerve. I've actually started using, not working out, but I've been using exercise bands to kind of do some tricep strengthening exercises. Everything that I've been using for PT has been good for my forearms already, so my forearms feel like they're getting worked out every single day. But I've actually, well, I can show you, been using bands and stuff. I've been using them to do curls and to do little tricep extensions. 4 weeks now. I started a couple of days ago, so I still consider I was 4 weeks into it when we're into recovery when I started. So I feel like it's about time, 2 more weeks, and then I'll feel pretty comfortable going a little heavier intensity, not heavy lifting by any means, but actually having a real workout regimen. Still been using all my PT equipment though, upgraded a little bit with this Putty. That stuff is actually very nice. Happy that I was able to get it. It was a good buy. And yeah, everything seems to be going well, besides the fact that I think I have carpal tunnel. That's kind of a letdown. I think it was really overlooked by the fact that my cubital tunnel was so bad on our subluxation. But like I said, I'm gonna put my arm down right now, and my thumb's starting to go numb. So yeah, 100% is starting to go numb. It's unfortunate. Well, I feel like I'm trading one problem for another one, essentially. Not mad though. I guess I'm getting closer to getting better every day. But yeah, it's the truth of the matter. So strong carpal tunnel syndrome. These fingers just feel tingly, heavy. The worst one is my thumb, followed by my index, followed by my finger, and then like I said, I'm always tender and sore in my thenar space. So yeah, that's pretty much it. That's the update. 4 weeks in, things getting better. Taking my time, still haven't done anything. Haven't been back to work yet. That's kind of a downer. Filed for disabilities. Haven't gotten paid yet. I've been off work it's been 2 months now. It's been a long time. But trying to get better every day. Hopefully I'll be back soon before I get fired. But yeah. Hope y'all having a good rest of your day, and I will chat with y'all at another time.